I wrote myself Dr. Anjan, emergency medicine postgraduate, Government THOOTHUKUDI Medical College and Hospital. I am here to speak about the BLS, that is basic life support. In our life, everyone will face this situation at any point of time, at anywhere. So, as a medicos, we have to know how to perform the correct method of BLS. Why the BLS? We have to know why we have to know the BLS. In the cardiac arrest is the final event of death. In cardiac arrest, when the heart stops, the blood flow to all organs stops. So BLS, what does? The BLS prevents or slows the damage until the cause is corrected. Okay? Any scenario, the first step of BLS is verify scene safety. That is, when the patient is in road traffic accident, there may be any glass particles, any materials. So first you have to take the patient to the safer zone, the flat surface. While performing the BLS in that spot, it will injure the patient and also the rescuer. So like that, I have to verify the scene safety. As same as like that, you have to, if the patient is in drowning, you have to take him to the shore side, and the patient when is in fire accident, you have to take him to the safer side. So this is the first step of the BLS, verifying the scene safety. Then the second step will be check for the response of the patient. So how will you check the response? You have to tap the shoulder. I will show you. So just go near the patient and just tap the shoulder. Okay. Hello, are you alright? Hello, are you alright? So just you have to only tap. You should not shake the shoulder because there may be any spine injury like that. You should not shake the patient. Just tap the shoulder. Are you alright? Are you alright? So now the patient has no response. So when you find the patient has no response, immediately call for help. You have to call for help. Then after calling for help, you have to simultaneously check for pulse and both breathing. So pulse, you have to keep your 3 fingers and the anterior quarter of sternum mass, right? While feeling the pulse, at the same time you have to look for chest rise, that is for breathing. So you can keep your ear over nose for the air to, you can feel. At the same time you have to look for chest rise. Then when you're feeling for pulse, it should be minimum of 5 seconds and maximum of 10 seconds. So you have to count like 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000. Maximum of 10 seconds you can feel the pulse. Now the scenario is that the patient has no pulse and no breathing. So when you find no pulse, no breathing, immediately you have to activate the emergency medical services and get AED as soon as possible. So after activating, and you have to call for help and activate this thing. After you activate, immediately you have to start on CPR. That is the chest compression you have to start on. Chest compression. For giving the chest compression, first you have to use the heel of one hand. That is, you keep the heel of one hand over the lower border of sternum, and the other hand should be locking with the first hand, and your elbow and shoulder should be in straight line, that is perpendicular to chest wall. The movement for the chest compression should come from your hip. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and there are high quality CPR. There are 5 points in high quality CPR. First is the rate, that is 100 to 120 chest compression per minute. And the second is the depth, which is 2 to 2.5 inch. That is 5 to 6 centimeter depth you should give. And you have to allow the chest recoil fully. That's the main step. Then the fourth point is avoid excess ventilation. And the fifth point is minimize the interruptions. This is high quality CPR. So while giving CPR, you should count loudly. Then only the next rescuer can come at the correct time. So you have to count like 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and so like that 30 compressions you have to give. So each 30 chest compression, 2 rescue breath. Now for rescue breath you have to give by oral mouth-to-mouth breathing you have to give. But if the rescue is willing for mouth-to-mouth breathing, he can give. If it's not willing, you can continue CPR chest compression alone. Okay. If he is willing for giving the mouth-to-mouth breathing, he can use direct mouth-to-mouth, or you can keep some hands like this, or some pipes, or some packet mask and give mouth-to-mouth breathing. Now I am continuing the CPR. That is chest compression. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 10 and 11 and 12 and 13 and 14 and 16 and 17 and 18 and 19 and 21 and 22 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 arrives. First you have to plug in this AED. Then after plugging, you have to keep the AED training pads over the chest wall. The one pad will be on the right infraclavicular. The one pad. The next another pad you have to keep on left side and below to the nipple. This is the another pad. So after connecting the pad, you have to switch on the AED, and after switching on, you have to follow the AED prompts. Okay, you will be continuing the CPR. We have to know the 2 points that when he has to stop the CPR. The first point is that when the machine analyzes the rhythm, you have to stop the CPR. And again, when you are delivering the shock, you have to stop the CPR. But at the same time, when it's charging, you have to continue the CPR, because these are done to minimize the interruptions. So CPR to be continued. The next step, now I am going to on the AED machine follow the prompts.
Analyzing heart rhythm.
Stop.
Do not touch the patient. Shock advised. Charging. Stay clear of the patient.
Okay, now I hear, you hear, all of
Do
you.
not shock now. Press the orange button. Shock delivered.
Now shock delivered. You immediately continue the.
Start CPR.
This is our scenario. The next scenario will be when we are checking for pulse and breathing simultaneously. The both pulse and breathing is present. Then put the patient in recovery position, that is left lateral position, and wait until the emergency medical service comes. At the same time, when you are looking for pulse and breathing simultaneously, when the pulse is present, but the breathing is not there, at that time you have to give only rescue breaths. That is 1 breath every 6 seconds. So we have to give 1 breath every 6 seconds. As before said, it should be given by mouth to mouth breathing. So while giving rescue breaths, every 2 minutes again you have to look for pulse. When the pulse again it is pulse is not there, then you have to immediately go to CPR. This is our bailless scenarios. Thank you.